Hi, good evening. My name is Dr. Raynard Riley of Patient First Dentistry of Summit, and I like to help people out and talk about certain frequently asked questions that people may have. And before I've talked about good oral hygiene techniques, and I've talked about tooth brushing and the advantages of manual toothbrushes as opposed to using electric toothbrushes. But one of the other things that we need to do as an adjunct to brushing is flossing, and that seems to be one of the adjuncts that a lot of people kind of leave aside and forget to do. And I like to tell my patients, sometimes it's difficult to always floss all the time. You're in a rush. So what I recommend for some people is sometimes if you have a particular TV show that you enjoy every single evening or the news, sometimes you can even keep that floss on the nightstand, and while you're watching TV, just floss. And when you do floss, you like to have, let's say, about 12 to 16 inches of the actual floss material itself. And when you use the floss and go in between the teeth, you want to use it in such a way that you're sort of massaging the sides of each and every individual tooth. So you take the floss, you go in between the tooth or the two teeth, and you sort of rub and massage the side of one particular tooth, and then physically lean the floss against the other side of the other tooth, and floss and clean that side of the tooth. Then you remove the floss, and we talked about using about 12 or 16 inches of floss. And then you want to sort of change the position of the floss so that you're not flossing any particular one area with the same piece of floss. Just goes a long way in terms of not transferring germs from one part of the mouth to the other. Now, with flossing, some people have big hands. They have problems reaching every single area of the mouth. You have what are called floss threaders, where particularly you can use these floss threaders as an adjunct to help you get to those difficult places to reach. So the back of the mouth, the molar area, you can use floss threaders as well. For individuals out there who may have bridge work, the teeth are physically connected to one another, so it's virtually impossible to floss in between those teeth. You have to use what's called a floss threader, where basically you'd have a piece of plastic which has a loop where you can tie the floss to the loop and loop it and string it underneath the bridge to clean and massage the sides of the teeth underneath the bridge work. And it's very difficult to floss with braces, and that's another segment, but you want to do the best you can. You can also use floss threaders with braces as well. So those are some of the helpful tips that I'd like to instill with people in terms of flossing. The main thing is consistency, doing it every single day, technique, massaging the individual sides of every single tooth, and using adjuncts when it's difficult for you. So floss threaders, floss holders is one adjunct to get to the difficult and far-reaching places in the back of the mouth, and floss holders and floss threaders to thread underneath crown and bridge work. Hope that helps. Thank you.